Good evening, Mr. Chairman, my dear colleagues. It is a pleasure for me to be here in the United States, and I present my thanks and appreciation to the conference organizers and to everybody help to make this conference successful. My lecture is about contributing between ortho, implant, and aesthetic dentistry. My name is Dr. Walid Odeh. I am from Holy Land, Jordan, land of Petra, the 7 wonder in the world, and land of the Dead Sea, the deepest point in the earth, and land of the baptism, where all the Christian people come to baptize. My first case about the contribution between implant and ortho, how ortho can be benefit to implantology. The first case about the development of bone site for implant by extruding the alveolar bone of hopeless anterior teeth by using orthodontic force. As you see here, central and lateral upper right side, there is a lesion, periapical lesion, and there is a loss of bone resorption. In this case, if we make extraction and we try to put 2 implants here, the alveolar bone is not enough, short, and loss of a lot of resorption. So the solution here is to make operation and take bone from the hip of the patient and put the bone graft here and wait 6 months, and later we put our implant. The patient refused to take bone from the hip. I began to take help from the orthodontic. We applied orthodontic appliance, and we began to make extruding for these 2 teeth, the central and lateral, by low force using the occlusal step. As we know, while we are making extruding for these 2 teeth, we also make extruding for the alveolar bone around the teeth. After we extrude these 2 teeth and we have enough bone, we make a gentle extraction, not traumatic extraction, and an immediate implant. We find small perforation in the buccal area. We put bone graft and membrane. We close the incision, and we put our 2 temporary crown, not leave the patient without teeth, and wait for 5 months. After 5 months, we make X-ray. We see a nice bone around the implant, a nice papilla and soft tissue. This is the temporary crown which we put. It was out of occlusion, not to have pressure for the implant. This is the final impression, and this is the final crowns. From this case, we can understand that the patient refused to take bone from the hip. And by the help of the ortho, we make solution for her problem, and the patient happy that she did not have big surgery and have her teeth without any problem. The second case is to using the normal implant to make traction or extrusion by using the normal implant as anchorage. This patient free and saddle, we put him to implant and make exposure for the canine, impacted canine, and by the anchorage of the implant, we began to make traction or extrusion until the canine came to the correct place. Case 3, the use of mini implant for intrusion of molars to create space for dental implants. As we see here, this patient make extraction for a long time. The lower molar super erupted. The space is very small here, 2 millimeter or 1.5 millimeter. We can't make a bridge, we can't make implant, we can't make a removable partial. What is the solution for this case if I did not use this mini implant? The first solution is to make incision in the upper jaw and cut little of the bone here. Perhaps the sinus is not far, so when we will put the implant, it will be a little difficult to make sinus lift. The second choice is to cut this lower molar to gain space. If I cut this molar, I need to make endo treatment. And if I make endo treatment, I need also to make crown lengthening because the teeth will be small. Instead of all this operation, I use 2 mini implants, one in the lingual and one in the buccal side, and a rigid wire fixed by composite. And we used power chain or elastic thread to make intrusion for these 2 teeth to gain space. And this is the space what we have after using intrusion for the lower molar. And we put 3 implants. Over the implant, we put crowns. As you see here, we save our lower 2 teeth without endo treatment or crown lengthening, and we gain space here to put 3 implants by the using of this mini implant. This is the panorama. See the space before and after. And this is the case before and after. The case 4, as we see here in there is impacted number 7 and number 8. Number 8 have no roots. It is not difficult, we can take it out. If we look carefully for number 7, it is very near the nerve, very close for the nerve. If we make surgical extraction maybe hurt the nerve, and numbness will have the patient for a long time. And if we make surgical extraction, we need to put here implant instead of this danger extraction, and to cost the money for the patient to put implant. We put many implant between 5 and 6, and we put brackets in 4, 5, and 6, and a rigid wire. This rigid wire, and this is the mini implant, this rigid wire we put on to the number 7 after we make extraction for number 8. We began to make extrusion until number 7 came, and we can see it. We put bracket, and we put another rigid wire, and we began to make extrusion and alignment to the teeth until this molar came to the correct place. This is in the panorama showing how is number 7 is in a good condition. We did not make any danger for the nerve, and we did not make the patient pay money or cost money for the new implant, and he won his normal teeth. Another case, tilted implant, tilted teeth. Here we can't put an implant, the space is small. We can't put a bridge. We put mini implant, and we began, and with power chain, we began to move this teeth, make uprighting for this teeth by the anchorage of the mini implant by power chain to make the teeth in the correct position. While we are doing that, maybe we have traumatic occlusion, so we can make reduction for the cusps. And this is the case before, and this is after. So by the help of many implants, the patient did not want to make implant, we make him bridge. By this case, and the help of many implant, we save the area, and the patient is happy that he did not make extraction for this teeth. Because many doctors, they said to him, we must make extraction because there is no place to put implant or bridge. This case, skeletal open bite. She went to the maxillofacial surgeon. He wants a lot of money, and she is poor, she can't pay this money. She came to me. I began my treatment to put her many implants in the upper and lower jaw. I put 4 mini implants. The implant between number 6 and 7, between the root. We must be careful when we put our implant not to touch the root because the space is very small, not like the normal implant. The space is 3 millimeters. We put the 4 implants. We put a lingual arch and palatal arch. And we began to make intrusion for the molars, the upper and lower molars. Make intrusion. And as we know, if we make intrusion for 1 millimeter down here and 1 millimeter in the upper, we gain in the anterior area 2 to 3 millimeter. So after 6-7 months, we close the open bite. The patient happy. She did not pay money for a big surgery and hospital and cost of money. And I make it, this is case before 10 years, and until now she is in good condition. The treatment of deep bite, also I use the mini implant. We put the mini implant between the two central, and we use the power chain or elastic thread, and we began to make intrusion for the centrals and the laterals. This is the mini implant, must be between the root. As I said, this space is small, it is 3 millimeter and sometimes less. And this is a case of severe crowding, broken teeth and broken roots. After clearing for the extraction area, the broken teeth, we use the mini implant for traction and alignment for the crowding teeth. Here we put 2 mini implants. Gum smile, we also make treatment for the gum smile by using the mini implant. We put mini implant between the two centrals or between the central and lateral. And in this case, I did not find space between, the space is very small here. I put it between lateral and canine. And we began to make intrusion. And this is the case after. This patient bring me his son, and his son have class 2 division 1. He want to make ortho treatment for him. I look for this man and I said, "Where's your teeth?" He said, "Oh, I lost it for a long time and the space is closed with this small teeth." I said, "Do you need ortho more than your son? Sit down in this clinic and I will make you and to your son." And really, I began with the father and his son together. We make him ortho treatment. We open space for the central because his face little shifted. The shifted midline was very bad in his face. And after we create a space, we put an implant. Over the implant, we put zircon crown, and to have a nice teeth, we put veneers in the other teeth. This is the case of skeletal class 2 division 1. We have protrusion in the upper jaw. We have shifting in the midline, and we have impinging bite. We began our treatment by using nitinol 14. We make extraction for the fours, 2 fours, left and right. We put mini implant between 5 and 6 on the right and left, and we put also 1 mini implant between the 2 centrals. And we began to make after we change the wires to 1622 stainless steel in the upper, and we put also 1925 TMA to make treatment for the lower anterior for the to treatment for the deep bite. For the treatment in the upper jaw, we used one mini implant. We began to make traction for the teeth in Massey, the 6 teeth together from canine to canine. And this is the case after. There is no protrusion, no shifting in the midline. The occlusion is nice. The patient is happy. I am implantologist also. After many cases come to us with a missing lateral. This is one of the case. After we make the space, we put an implant in the missing laterals, and this is the crown over the implant. It looks the same color. This is the patient, and this is after the crowns. And this is the implant in the panorama. Another case, ortho, implant, and crown. This is another case for broken molar. We make extrusion by the help of mini implant. After that, we make build up for the molar, and the patient want to make bridge. This patient, I make her orthodontic treatment. She is a beautiful lady, and the teeth is very beautiful. She came to me, I don't like the length of my teeth. I like my teeth to be like Angelina Jolie. I like it to be more long. So I advise her, your teeth is beautiful. She refused, she wants long teeth. We make crown lengthening, and after that we make the veneer, and she is happy with this length of the teeth. This is another patient. We make orthodontic treatment before 6-7 years. She did not use the retainer. After that, she have an accident. One of her teeth is broken. We make aesthetic crowns and veneers, bridge and veneer. Another patient make orthodontic treatment in another country, came to me. She said, I don't like the color of my teeth. They are yellow. We make her the veneers, and she is happy. This patient have 2 problems. She always went to the dentist to make bleaching. She smoking, and she's drinking coffee and tea too much. And she have gum smile. We treat the gum smile by the Botox, and we treat this coloration because every time she make bleaching, and after less than 10 days began to be dark and spots in the teeth. We make her veneers. She is happy, and no gum smile. And this patient have spaces between the centrals and the lateral, crowding between central and lateral, the lateral sitting in the central, and there is space between the canine here and the lateral. We make her, she will marry after 4 days. She haven't time to make ortho treatment. We treat the teeth this by veneers. This patient have a nice occlusion, but big diastema. He don't want to make any orthodontic treatment. We must see the cause of the diastema. I make him frenectomy and clean the area here from the ligament. And after that, we make the veneers. This patient see her mother make veneers in my clinic. She said, I want to make veneers for the 6 teeth. I refused. I said, your teeth very beautiful. I can't touch these 2 teeth, the centrals. The laterals, there is a space here, and they are inclined inside. It is not in the same position of the centrals. She had space here and in mesial and distal area, and they are inclined. I make only for the 2 laterals, this one and this one. It was the same color, and it was very nice, and we did not use veneer for the centrals and the canine. Here, the spots of the Botox to treat the gum smile and the bruxism and the TMJ pain. This is in the temporale. Here we can, for the bruxism, give 2 dots with the masseter muscle. This will prevent the bruxism and the TMJ pain and the headache pain also. And this is here we put in the superior labii muscle for the gum smile. This patient have orthodontic. After we finish the upper, we give her Botox for the treatment of the gum smile. And this is another patient, but without treatment of, she want only treatment of gum smile. Here, the patient have a bruxism for a long time. She go to many doctors. Every doctor give her the night guard. She used the night guard for 1 night, 2 nights, and throw it. She said, I can't sleep with the night guard. So she came to me. She know that I can treat by the Botox. We make the measurement to know where's the place of the masseter muscle and where we will put the dots to give the Botox. I can catch the masseter muscle inside the mouth or outside the mouth while she's clicking and put the 3 dots or 2 dots in the masseter, and after 1 week she will have the result and she will be relaxed and not make glitching and bruxism. This is a case treatment by the Botox of the gum smile. As I said, I put the dots where I can put the Botox, and this is the case after. Another case of contributing between implant and aesthetic. We put implant for this patient in the two side, right side and the left side. And after that, he said, my teeth, front teeth is yellow always. I want also to make aesthetic. We make him veneers in the front side. And this is Wadi Ram from Jordan. Thank you very much.
Any question, please?
First of all, thanks, doctor, for this presentation. I have two questions.
Yes.
First one about number 10, case number 10 about the gummy smile. You placed 2 micro implants to do an intrusion for the incisors. We can we put RCS for it, or there is a contraindication? Yeah, I mean, it's little difficult than place 2 micro implants, or
usually I am the first one who used the mini implant in Jordan, and I find it more easy.
Oh, so no contraindication for the
contraindication.
Okay.
As you like.
The second one about the Botox and paroxysm. Is it temporary treatment or?
Usually the Botox have a limited time. It is 6 months, 5 to 6 months.
Okay.
After 5 months, she must come to take another Botox, and another 5 months to take. At that time, the muscle, after 3 shots, the muscle will be much relaxed. Perhaps she did not need, especially also for the gum smile. Yes. The solution is to make surgery, lip reposition. Instead of this operation, we give very easy in 1 minute. Injection. You give her the injection, and the patient continue after 5 months another injection. The cost of this 3 treatment less than to make a surgical operation, and as I said, this muscle will be a little soft, and it will solve the problem.
Okay, thank you very much.
Thank you very much. It's for your recognition.
Thank you.
It's okay.
Thank you. Thank you.